Welcome to Lento English. Ready to level up your English? Here we learn through stories, slow, clear, and fun. Listen, relax, and enjoy the journey.
1. Introduction. Imagine you need an operation. Perhaps a doctor needs to fix something inside your body. Now imagine this operation happens without anything to stop the pain. You would feel everything. This thought can be very scary. Luckily, in modern medicine, this does not happen. There is a special way to make sure you do not feel pain during medical procedures. This special way is called anesthesia. Anesthesia uses medicines to help people avoid pain during operations or other medical tests. It helps make sure you are comfortable and safe. The main question we will answer in this lesson is, how is it possible to not feel pain during surgery? This book will explain how this amazing process works. We will look at how your body sends pain messages. Then we will learn how special medicines can stop these messages. We will also discover different types of anesthesia. Some types make you sleep completely. Other types just numb a small part of your body. We will also learn about the important doctors who give these medicines. The purpose of this book is to explain anesthesia in an easy-to-understand way. It will help you learn about this important part of healthcare. You will see how doctors can perform difficult operations safely. And you will understand how patients can stay comfortable during these times. By the end, you will know much more about how anesthesia helps people every day. 2. Your body's message system. Our bodies are amazing. They have a special system that helps us know what is happening around us and inside us. This system is like a big communication network. It is called the nervous system. The nervous system has 3 main parts. First, there is the brain. The brain is like the main computer or control center of your body. It receives all the messages and tells your body what to do. Second, there is the spinal cord. This is a long cord of nerves that runs down your back from your brain. It is like a main highway for messages. Third, there are nerves. Nerves are like tiny wires that go all over your body. They connect every part of your body to the spinal cord and the brain. Together, the brain, spinal cord, and nerves work to send and receive messages very quickly. Imagine you accidentally touch something hot, like a stove. What happens? Your body needs to tell you that it is hot and that it hurts. This is where your nervous system comes in. When your hand touches the hot stove, special parts in your skin feel the heat and the pain. These parts are like tiny sensors. They create a signal which is a message of pain. This pain message starts its journey from your hand. It travels very fast along the nerves in your arm. Think of these nerves as a road for the message. From the nerves in your arm, the message then travels up to your spinal cord, which is the main highway. Once the message is in the spinal cord, it continues its journey straight up to your brain. When the pain message reaches your brain quickly understands it. It processes the message and tells you, "That hurts, move your hand." This whole process happens in less than 1 second. It is how your body warns you about danger and helps you react quickly. So the nervous system is always working, sending and receiving important messages, including those about pain, to keep you safe and aware. It is a very clever system that helps your body communicate with itself. 3. How the message is stopped. In the last chapter, you learned about your body's message system. Pain signals travel from a body part to your brain. Now imagine stopping these messages. This is the main idea behind anesthesia. Anesthesia uses special medicines. They stop pain messages, preventing them from reaching your brain. Think of your nerves as roads. Pain messages are like cars on these roads driving to your brain. Anesthesia builds a block. The cars or pain messages cannot pass. They cannot reach the brain. So your brain does not know there is pain. You do not feel it. This blocking is very important during medical procedures. For surgery, doctors work on your body. Without anesthesia, you would feel everything. With anesthesia, pain messages are stopped. Your brain never gets the signal. You can have surgery without pain, staying safe and comfortable. How do these special medicines work at a small level? Your body has tiny nerve cells. These cells send messages. They talk using small chemicals called neurotransmitters, like little messengers. When a nerve cell sends a pain message, it releases neurotransmitters. They tell the next nerve cell to pass the message on. Anesthetic medicines work with these neurotransmitters. Some stop their release. If messengers aren't sent, the message cannot travel. Others make your body release different messengers. These tell nerve cells to stop, not to pass messages. The pain message stops at the start, never traveling far. For example, a common medicine is propofol. It helps stop nerve cells from talking, making it hard to send signals. The pain message cannot move from one nerve cell to the next. It simply stops. Your brain does not get the message, so you do not feel pain. So, anesthesia blocks the pain message. It stops the message from traveling up nerves to your brain. It does this by working with small chemical messengers in your body. This allows doctors to do their work. You stay safe and free from pain. 4. A deep sleep for surgery. This chapter talks about a very important type of medicine called general anesthesia. This medicine makes a person go into a very deep sleep. It is like being completely unconscious. When you are given general anesthesia, you are not awake at all. You do not feel any pain during the procedure. You also do not remember anything from the time you were asleep. This is because the medicine affects your whole body. It works to stop all the pain messages from reaching your brain. Your brain cannot receive these signals, so you cannot feel them. This type of deep sleep is used for big operations. For example, if a doctor needs to do a major surgery inside your body, general anesthesia is often chosen. It allows the doctors to work for a long time without you feeling any discomfort. It truly helps to make complex medical procedures possible. There are different ways for doctors to give you this special medicine. One common way is through a small tube. This tube is called an IV line. It is usually placed into a vein, often in your arm or hand. The medicine then goes quickly into your blood. It starts to work very fast, making you feel sleepy before you fall into a deep sleep. Another way to get general anesthesia is by breathing a special gas. You might breathe this gas through a mask that covers your nose and mouth. You take deep breaths and the gas makes you fall asleep very fast. Sometimes, after you are asleep, a small tube is placed in your throat. This tube helps you breathe easily during the entire surgery. It makes sure your body gets enough oxygen and maintains good breathing. The doctors watch you very carefully while you are in this deep sleep. They check your heart rate, your breathing, and other important body signs. They make sure you are safe and comfortable throughout the whole operation. When the surgery is finished, they slowly stop giving you the medicine. You will then start to wake up. You might feel a little sleepy or confused at first, but this feeling usually goes away. You will not remember the surgery itself. This deep sleep created by general anesthesia is a very safe and important part of modern medicine. It allows doctors to perform many kinds of big operations that help people with serious health problems. It makes these important medical procedures possible and safe for patients. 5. Numbing a big area. After learning about the deep sleep of general anesthesia, we will now look at another important way to stop pain. This is called regional anesthesia. Regional anesthesia is different because it does not make the whole body sleep. Instead, it makes a large part of the body numb. This means a person can stay awake during a medical procedure, but they will not feel any pain in the area where the doctor is working. Imagine you need to have surgery on your leg or arm. With regional anesthesia, only that specific part of your body, or perhaps a larger section like your entire lower body, would feel numb. You could talk to the doctors or nurses if you wanted to. You would know what is happening around you, but you would not feel anything in the numb area. This is a big difference from general anesthesia, where you are completely unconscious and unaware. The goal is to let you be awake, but without any feeling of pain or discomfort in the place where the medical work is being done. How does regional anesthesia work? Doctors give this medicine by injecting it close to a group of nerves. These nerves are responsible for sending pain messages from a specific part of the body to the brain. When the medicine is injected, it works to block these messages. It is like putting a temporary wall in the path of the pain signals. So, the signals stop before they can reach the brain. This way, you do not feel pain in that big, targeted area. The medicine temporarily turns off the ability of those nerves to send their signals. There are different kinds of regional anesthesia. Two common examples are epidurals and spinal blocks. You might have heard about epidurals, especially when talking about childbirth. An epidural is a special injection given in the lower back, near the spine. This medicine then spreads around the nerves there. It numbs the area below the waist. It helps people giving birth to feel much less pain during labor. They can still move their legs, but they do not feel the strong pain of contractions. It allows them to be part of the experience while managing discomfort. Another common example is a spinal block. This is also an injection given in the lower back, very close to the spinal cord. It works very quickly to numb a large area of the body, usually from the waist down. Spinal blocks are often used for surgeries on the lower body, like on the legs, hips, or lower stomach area. With a spinal block, the patient feels no pain in the numb area, but they are still awake and aware of their surroundings. This can be helpful for surgeries where the patient needs to be awake, or when general anesthesia is not the best choice. Sometimes, doctors choose regional anesthesia because it can be safer for some people than general anesthesia. For example, if a person has certain health problems, staying awake might be better for their body. Also, after regional anesthesia, people often feel less sick to their stomach than after general anesthesia. They might also recover their normal feelings in the body part faster. This type of anesthesia helps doctors perform important procedures while keeping patients comfortable and safe. It is a smart way to help people during medical procedures while keeping them comfortable and safe. This method is chosen for many different reasons, always with the patient's comfort and safety in mind. It is important that the doctors know exactly where to put the medicine to make sure it works well and safely, targeting only the needed area. 6. Numbing a small spot. Sometimes a medical procedure is very small, affecting just one tiny part of your body. For these times, doctors use special medicines to stop pain. One type is called local anesthesia. Local anesthesia numbs a very small, specific area. For example, if you need stitches for a small cut, or if a dentist works on one tooth. For these minor jobs, local anesthesia is very helpful. It stops pain only in that exact spot. You stay fully awake during the whole procedure and can talk to the doctor. In the numb area, you will feel no pain. This numbing medicine is often given as a small injection. A tiny needle puts the medicine right into the skin or muscle. You might feel a quick prick, but the area quickly goes numb. For very surface-level work, the medicine can be a spray or an ointment. These methods ensure only the small spot loses feeling. The rest of your body feels normal. This anesthesia is simple and affects only the part where the doctor is working. It helps doctors do small procedures without pain or making you sleep completely. There is another medicine doctors use for procedures that are not big but might make you feel nervous. This is called sedation, sometimes called twilight sleep. Sedation makes you feel very relaxed and sleepy. You are not fully unconscious, like with general anesthesia, nor are you wide awake. You might feel like you are drifting or half asleep. You can usually hear and answer simple questions. However, you might not remember much about the procedure later. Sedation is often used for procedures that are not very painful but might be uncomfortable. For example, if a doctor needs to look inside your body with a small camera, it helps you stay calm and still. The medicine can be given through a small tube in your arm called an IV line. Sometimes it is a pill you swallow. The main goal of sedation is to make you comfortable and relaxed. This helps the doctor do their work easily. You remain conscious, meaning you are aware but in a very calm and sleepy state. It is a good choice when you need more than just a numb spot. 7. The sleep doctor's work. Anesthesiologists are very important doctors. They have special training. Their main job is to make sure people do not feel pain during medical procedures. They also work hard to keep people safe and comfortable before, during, and after any operation. Their important work starts even before a procedure begins. First, the anesthesiologist meets with the patient. This meeting is very important. They ask many questions about the patient's health history. They want to know about any past illnesses, if the patient has any allergies to medicines, and what medicines the patient takes regularly. This detailed information helps them understand the patient's body very well. Based on all this information and the type of surgery planned, they choose the best type of anesthesia. They decide if the patient needs to be fully asleep with general anesthesia, or if a part of the body should be numbed with regional or local anesthesia. Sometimes, They choose sedation to help the patient relax. They also carefully decide the right amount of medicine for each person. Every person is unique, so the plan is always special and made just for them. During the medical procedure, the anesthesiologist is always present. They are right there in the operating room. They are the ones who give the anesthesia medicine. This can happen in different ways. It might be through a small tube placed in a vein in the arm called an IV line, or it might be a special gas that the patient breathes through a mask. For some smaller procedures, the medicine is given as an injection directly into a specific area. Once the medicine starts to work, the anesthesiologist watches the patient extremely closely. They use special machines to help them. These machines show important information about the patient's body in real time. The anesthesiologist continuously checks many vital signs. They carefully look at the patient's breathing. They watch the heart rate to see how fast the heart is beating. They monitor the blood pressure to ensure it stays at a healthy level. They also check how much oxygen is in the patient's blood. If any of these numbers change, the anesthesiologist knows right away. They can quickly give more medicine, change the amount of anesthesia, or take other steps to keep the patient safe and stable. Their main goal is to ensure the patient remains safely asleep or numb and comfortable throughout the entire procedure. After the procedure finishes, the anesthesiologist's work is still not done. They carefully help the patient wake up slowly from the anesthesia. They continue to watch the patient as the effects of the medicine wear off. They make sure the patient is not in too much pain as they become fully awake. They also look for any problems that might happen as the patient recovers. This careful and continuous work helps patients recover well and safely. The anesthesiologist's role is truly essential for safe and comfortable medical procedures. 8. A very important medicine. We have learned many things about how special medicine helps people during medical procedures. This medicine is called anesthesia. Its main job is to stop you from feeling pain. Anesthesia makes it possible for doctors to help you without you feeling any discomfort. Your body has a system for sending messages. This is your nervous system. It sends pain signals from your body to your brain. When you get hurt, nerves send a message. It travels to your brain and your brain feels pain. Anesthesia works by stopping these pain messages. The medicine blocks the path of the signals. Pain messages cannot travel to your brain. Because your brain does not get the message, you do not feel the pain. This is how anesthesia lets doctors work while you stay comfortable. There are different types of anesthesia. For big operations, general anesthesia makes you sleep deeply. You will not remember anything. It affects your whole body. Doctors give it through a tube in your arm or by breathing a special gas. Sometimes you stay awake. Regional anesthesia numbs a larger body part like an arm or legs. You will not feel anything there. It is used for operations on a leg or during childbirth. For small procedures like stitches or dental work, local anesthesia numbs a tiny spot. You stay fully awake. The doctor gives this medicine with a small shot or a cream. Another type is sedation or twilight sleep. This medicine helps you feel relaxed and sleepy. You might be awake, but you will not remember much. It is used for smaller procedures where you need to be still. The anesthesiologist is a very important doctor. They specialize in anesthesia. They choose the best medicine for you. They watch you carefully during the procedure, checking your breathing and heart rate. Their job is to keep you safe. In summary, anesthesia is a wonderful medical invention. It stops pain signals from reaching your brain. This lets doctors do many important medical procedures. From small dental work to big surgeries, anesthesia makes it possible without pain. It helps millions of people daily. It is truly a very important medicine. It makes medical care safer and more comfortable for patients.